be discussing a clinical case involving a dog that presented with an inability to bear weight on his hind limb after receiving an intramuscular injection. The dog is knuckling on the affected side and has a sensory deficit on the cranial, caudal, and lateral aspects of the limb below the femur. To give context, we're going to explain the normal anatomy of the hind limb region affected through a series of dissection videos. Firstly, we must orient ourselves with the palpable landmarks. The greater trochanter of the femur, ischiatic tuberosity of the pelvis, calcaneus, tibial tuberosity, and patella.
To remove the skin, we have utilised a blunt dissecting technique, but have had to swap to a sharp technique due to our instrument struggling to cut through the fat. The hind limb is primarily controlled by the sciatic nerve, which innervates muscles responsible for flexion and extension of the hip and stifle joints. The sciatic nerve originates from the lumbosacral plexus. It is a combination of spinal nerves L6, L7, and S1. Spanning from the spinal cord, this nerve runs over the greater sciatic notch of the ilium of the pelvis. It then innervates the hamstring muscles. We can see the nerve more clearly as the biceps femoris is reflected here. The nerve lies over the top of the semitendinosus and semimembranosus.
At the stifle, the sciatic nerve here splits into the tibial and peroneal nerve responsible for sensation and motor control in the lower limb. The peroneal nerve innervates the craniolateral group of the crural muscles, also known as the extensor group, which includes the peroneus brevis, lateral digital extensor, peroneus longus, long digital extensor, and cranial tibial. These muscles are responsible for hock flexion and extension of the digits in the hind limb. The tibial nerve innervates the caudal group of the crural muscles, also known as the flexor group, such as the gastrocnemius, popliteus, deep digital flexor, and superficial digital flexor. These muscles control dorsiflexion of the digits and extension of the hock via a lever arm of the tuber calcanei.
In this case, the dog's knuckling indicates sciatic nerve damage, likely caused by the intramuscular injection. This has compromised motor function in the muscles that it innervates and has caused sensory deficits in the limb, leading to reduced weight-bearing abilities and sensory loss of the cranial, caudal, and lateral aspects of the limb. The injury affects the nerve function of the entire limb below the femur and can result in temporary or permanent disability depending on the severity. Early interventions such as physiotherapy and/or surgery can improve outcomes of the case.